welcome all of you. सबसे पहले मैम शारदा मैम का and शर्मा सर का welcome. And today the speaker is Dr. Shivani and moderated by Dr. Jyoti Malik. So welcome all of you, Dr. Sunita, Dr. Aruna, Dr. Poonam, Goyal, and we are here again with the infertility update in this COVID third wave, and with the positivity and with this feeling that the surrogacy law and ART and this donor thing should not bother us long, and we should know what the gist is, and all of us has to be united and make a consensus on what has to be done for the board and for the laws to come. So we want to know what differences that previous law was, and from new laws, what changes has happened. So I request Dr. Jyoti Malik, please take over and start on with this surrogacy and ART bill update.
Dr. Shivani will first speak, give a talk.
Okay, Dr. Shivani. Dr. Shivani, we are happy कि मैम ने आपको announce किया है कि you are a leader of that, and we all know that you are a leader.
Let me introduce Shivani. Shivani is supposed to be the queen as far as surrogacy in Asia is concerned. Her number, nobody can surpass it. And I think, she has to become a leader as far as not only Delhi is concerned. Delhi, though, she will definitely support. But I think, because of her interest in it, I'm sure she knows the integrity of everything. And with that particular background, she is going to discuss it with new surrogacy law. So over to you, Dr. Shivani.
Madam, just 1 minute. I think Dr. Sonia Malik is also in the line.
Okay.
She's also joined. I think we should welcome Dr. Sonia Malik.
Welcome, ma'am. Sonia ma'am. Ma'am, dekh nahi rahe वैसे.
Madam Sonia Malik.
Thank you very much. Thank you very much. I'm very much here. Thank you so much. Good afternoon, ma'am.
Madam, actually, to be very frank, डॉक्टर साहब तो कहते हैं, डॉक्टर ब्रिगेडियर शर्मा कहते हैं कि डॉक्टर साहब हम लोगों की हलवाई की दुकान खोल लेनी चाहिए, बट नहीं, हमें डरने की कोई जरूरत नहीं है. This is what I feel. We are the good abiding citizen of the law. We will definitely follow the law in total, but किसी को भी डरने की जरूरत नहीं है. This is what it is. So I think, we will have plenty of time for discussion. Over to you, Dr. Shivani. I'm sure as for the surrogacy is concerned, your presentation should be such that, nobody should be scared.
Thank you so much, respected Sharda Jain ma'am, for always being an icon, inspiration, and your guidance. Brigadier Sharma sir, what an honor to welcome you here, and respected Sonia Malik ma'am, heartfelt gratitude you had here with us in our program today. And before we start, I would really request if Sonia Malik ma'am and Brigadier Sharma sir, if you would like to give us a few pearls of wisdom, and then I can do a short presentation on ART bill and surrogacy, and at every step to discuss the provisions. Dr. Jyoti, if you can step in and at every step just maybe clarify or discuss, that will be really good. So we can have an interactive meeting from the beginning itself. ब्रिगेडियर शर्मा सर, आपके कुछ इनिशियल थॉट्स इस बिल पे आप अगर हमें एज एन एक्सपर्ट कुछ बताना चाहे, a few words.
The thing is, this bill, why it came, we should know that, and why it may take a further wrong direction, we should know that. Thing is that if we were doing our work without making much of publications in newspapers and all, possibly it wouldn't have come into the main limelight. So, and if we still continue doing like this, behind every bus some advertisement, some three-wheelers advertisement, so we are bringing ourselves into the focus of the society. People feel that yes, we may be earning so much of money and easy money, and we must be doing wrong. So that is one thing, why the bill has come and why it may become more stringent in times to come. That is the one point. The second point is that yes, rules and regulations were needed, so we welcome them. But at the same time, what I feel is that documentation should be standardized either at the ICMR level or in the the DGF level, so that like in embryology, what all documents you are going to make, and while ultrasound, what all documents should be there, it should be standard. We should have in all the centers, at least in Delhi, so that we know that okay, I am filling these many forms and I am making these many registers in the virology and these many consents at this many stages I am taking it. So it should be uniform, so that all of us, those who are beginners or those who are too busy to look into this documentation, we all end the same platform. And the next is that yes, with this new law coming, our hands will be little tight, because sometimes the treatment to the poor will become little difficult. This is my personal feeling, because if I have to do so much of documentation, I have to employ more people also, and then I have to maintain the records and send it here and there and there, and how the system works. So the cost of treatment is going to definitely increase, and the poor patients, like suppose the egg donation is concerned, many people from the lower class also need egg donation. Now, if they have to take from the bank, and now the insurance of the donor also along with that, so that cost will be borne by the patient only. And out of that 7 eggs which you and me will get it, after thawing, how many will survive and how many will form the embryos, and definitely the results will be different. So I foresee, a lot of practical problems and the problems for the poor patients, because of all these legalities which are involved. But however, we are no one to say that, because after all, somewhere the patients also should make noise. Why should I be, talking about all the, patients, when the patients themselves are sitting and they are ready to pounce on us at any time. So I think we need to educate our patients also, that they should also make noise, and whatever changes can be brought out, for the benefit of the patient, should be brought out. And at the same time, we all should work legally, and same documentation, same the legal papers should be done in each level uniformly. Same should be maintained throughout all the centers. This is what I feel.
Excellent. So again, thank you everybody for joining in, and respected Sonia Malik ma'am, a very warm welcome. And please give us a few words of wisdom as we start the program today.
Thank you very much. And I'm sorry I'm intruding like this. I came here to listen, but in any case, thank you very much, madam. Thank you, Dr. Sharda. Thank you, Shivani, and of course, Dr. Sharma. What you have summed up is beautiful, very well said, and you have actually brought out the points which we all should be very, very, bothered about and be careful about. The other thing is that the general gynecologists, those who are not doing IVF, will also have to be careful, because even IUI and anything that has to do with gametes is going to come under the ambit of the CRT bill, and therefore even semen processing, handling, etc., which I'm sure Shivani is going to talk about, is going to be under the bill. So if you want to practice these things in your clinic, you will also have to register. So this means a lot of work even for the gynecologists. And of course, you are going to come under it just like the PNTT bill. And like Dr. Sharda Jain said, there is really no need to feel scared. Because at the end of it, please remember that infertility is not about third-party reproduction only. The majority of our patients who are coming to us are coming for their own problems. Third-party reproduction is only 30% of our work. So the rest of it is just their own gametes. So that is why we don't have to really worry as to what is going to happen to all of us, because basically all of us are doing, like Dr. Sharma said and Madam said, we are doing our practices religiously and seriously and very sincerely. So I don't think it is going to make much of a difference. But of course, yes, we are going to come under strict vigilance now, and the focus is going to be on all of us. So we have to be careful. Thank you so much. Thank you very much.
Thank you so much, ma'am. And Dr. Jyoti, should we go ahead now? Or...
Yeah, I think so. Yeah, Dr. Shivani, we are waiting for your talk. And then we will have all this interaction from Sonia ma'am, sir, and Sharda Jain ma'am. Then we will all put our heads together and again do a rigorous work after your talk. We'll have a good discussion.
Okay, so you have to share a window or a tab every time I make this mistake here.
Present now.
Oh God.
Yeah, it is coming.
No, but this is your email which is coming. No.
This is my email.
That's your email. Present
Okay.
now. See, my PPT is open, but I'm not able to get this PPT.
मैडम इसमें करेंगे ना तो इसमें एंटायर विंडो करेंगे, एंटायर विंडो करने के बाद उसको टिक करेंगे और इसमें शेयर आ जाएगा, उसको करेंगे तो आपका पीपीटी आने लगेगा.
इसमें entire ठीक है. So let me go for the entire screen. And entire screen में वो PPT नहीं दिख रही. 1 minute.
मैम एंटायर स्क्रीन के बाद एक छोटी विंडो खुली होगी.
हाँ, छोटी विंडो में मेरी PPT नहीं खुल रही ना.
उस पे टिक कीजिए आप एक बार.
या बट उसमें यही आ रहा है, मेरा PPT नहीं आ रहा.
शेयर पे कीजिए टिक. हाँ हो गया. अब इसको
नहीं, पर ये मेरा स्क्रीन आ रहा है ना.
इसको मिनिमाइज कीजिए. आपका
अच्छा,
अब खुलेगा. अब दिख गया.
अब आ गया.
हाँ जी मैम आ रहे हैं.
Okay, so very warm welcome to all to the ART and Surrogacy Regulation Act. One of the most beautiful quotes by Maya Angelou, be a rainbow in somebody else's cloud. And this is the gazette that was notified on 20th of December 2021, which is now being called as the Assisted Reproductive Technology or the ART Regulation Act 2021. Most important definitions from these act I have shortlisted. So first of all, the definition of ART is defined as all the techniques which attempt to obtain a pregnancy by handling sperm or oocyte outside the human body and transferring the embryo or gamete into the reproductive system of a woman. So it, as Sonia Malik ma'am said, it includes IUI and IVF-ICSI. Because the previous bill, or even now if you see CDC definition of ART does not include IUI. But in India, we must remember that we also include IUI because it is handling the sperm outside the body. What is an ART clinic? Any premise equipped with requisite facility, medical practitioners which are registered for carrying out any procedure which is related, not only just directly ART, remember any procedure even related to ART becomes now ART clinic. What is the ART bank? Organization, lot of importance has been given to ART bank in this bill. Organization responsible for collection of gamete, storage of gamete, supply of gamete to the ART clinic or to the patient. And who is a commissioning couple? Any infertile married couple approaching the clinic, or the couple can approach the ART bank also directly to obtain services. Who is a gamete donor? Any person, it can be relative, non-relative, anybody who provides sperm or oocyte with objective of enabling infertile couple or woman to have a child. It's a major shift. So relatives are not barred anymore. Definition of infertility: inability to conceive after 1 year of unprotected coitus or other proven medical condition which are preventing the couple from conception. Now, coming into the boards. So this is the regulatory framework that has come. There are 5 levels. First is the ART National Board. This means National Board and Surrogacy Board both. And the definition is under subsection I of the 15 of Surrogacy Act. So Surrogacy Act has been given a lot of importance in the ART bill because the definition of the ART board has come from there. Then there is a national registry. It is a registry for ART and surrogacy both. National ART and surrogacy registry has to be established within 90 days of implementation of the bill. So the day the bill is implemented, within 90 days, this registry will be established. This registry is a central database in the country to which all the details of all the clinics and banks, including nature of services, outcome of services, everything will be there. Means imagine there is going to be a national registry where the aim is to have a complete and detailed record of each oocyte, each sperm sample, each single embryo that you are generating in your lab, each semen sample. And this has to be kept by the clinic ready at all times, and you have to submit this online. the data which is generated from the national registry should be used by making policy guidelines and research area. I mean, this is really something very secondary, but this is what is mentioned. Now, ART Regulation Act, under this, the definition of state boards and appropriate authority. So state ART and surrogacy board is going to be one common board. Earlier, they were supposed to be two separate boards. Now they are being clubbed as one common board. And AA means appropriate authority. Now, this appropriate authority also has to be appointed within 90 days of implementation of this act. And who is going to be the AA? There are 5 members. First of all, one joint secretary above the rank from the Family Welfare Department, who is going to be the chairperson. Then officer above rank of Joint Director of Health and Family Welfare, Vice Chairperson, eminent woman representing women's organization, officer of Law Department, and see the 5th one, eminent registered medical practitioner. And this is the part where the Gynecologist Forum, I think, has to take the lead. Hopefully it will, we will get an opportunity to be represented here. Now, what are the functions of the AA? The AA is going to be the most important person for all of us who are practicing, because this authority has the power to give the license, suspend the license, investigate complaints, take legal action, day-to-day supervision, give its recommendation to the state board, national board, investigations, and all other functions as prescribed, to summon any person, produce any documents, search any place. So the most important point of contact for us is going to be the AA. So what is the process now for registration for the ART clinic? If you want to practice IUI or IVF, the first thing you have to do is that within 90 days when the AA is appointed, within 60 days of that, you have to submit your application. I don't know if you have received the form under the ICMR, but a lot of us have received. And this process, ideally, of registration has to be completed within 60 days from bureaucratic or reasons are there, so the time gets extended. Always remember, the state board now is going to come and inspect the premises before you are given registration. This registration is going to be valid for a period of 5 years and can be renewed after 5 years. Now, these are the other functions of the state board I have just mentioned. So just to summarize, how will the registration happen? Say the ART bill is implemented today. Within 90 days, we need to have an appropriate authority and the national registry. Within 60 days after this, we have to submit our applications to the AA for registration. Within 6 months of implementation of the Act, ideally all the clinics and the banks should be registered. And during this time, there will also be an actual physical visit of your premises by the state board. Now, they have very clearly defined that any woman who's above the age of 21 years who approaches the ART clinic or bank for services is defined as a woman. So there is absolutely no treatment of any kind to any woman who is below 21 years of age. What about financial compensation for egg donors? Any medical geneticist, gynecologist, RMP should not purchase gamete donors or use any intermediaries to obtain gamete donors. So there is nothing which is specified in what way can you compensate any egg donors. I mean, this is going to be one of the very tricky parts to get any kind of donor. Now the sale because the ICMR had raised this point that will this not lead to shortage of donors? So the reply given to them was that even if there is a shortage, but there should not be exploitation. And according to them, payment is exploitation. So now this also remember the sale, transfer, use of gametes, embryos or any information directly or indirectly to any party within or outside India is prohibited except for own gametes. What does this mean? No couple can donate any of their extra embryos to anybody. Now the clinic and ART bank shall ensure that the commissioning couple or the woman, because remember single men are not allowed, only married women who are divorced or widows as single women and couples are allowed to do ART. So they are eligible to avail under such criteria. Now, first thing the clinic has to do is you have to give professional counseling with all the implication chances of success. So I strongly feel every clinic will need to have a board of their own. That board is going to make sure that all the cases that are there are fulfilling criteria, fulfilling all the forms, and also going to be a negligence board. So there should be a standardized form that we all have, that you tick all the points, that in counseling, this is what is the information, chances of success, advantages, disadvantages, so that they can come to a informed decision. Information about the couple, woman, donor has to be kept confidential, and information about the treatment should not be disclosed to anyone except to the database in the National Registry or in medical emergency. Every clinic and bank should maintain a grievance cell. So even if you have a small IUI clinic, every clinic, you need to have a board. You need to have your grievance cell so that all the cases can be discussed and anybody who has a grievance can apply there. Woman has to be about 21 years of age and less than 50. Man has to be about 21 and less than 55. And the discharge card has to mention the exact details of the treatment. And all the clinics and the bank, you have to submit all the information to the national board, National Registry, State Board, whenever they desire. And no treatment without consent, of course, and insurance. Now, this is something which has come new, that insurance coverage of such amount, they will specify the amount. The time they've specified is 12 months. And the reason is for any loss of life or any injury. Now, there are no insurance companies as of now, but I'm sure after this bill, some people will come ahead. Cryopreservation, not to cryopreserve any human embryos or gamete without specific instruction and consent from all the parties. In case of death or incapacity, what will happen has to be clearly mentioned. So cryopreservation consent has to be very detailed. ART banks will be doing medical tests for the donors, and the list of the test is going to be given by the board. Insurance, again, company, individual. Now here, why I put this up is because, see, this says that the commissioning couple can take out the insurance for the oocyte donor. So if the commissioning couple take out the insurance for the donor, the anonymity part, it is likely that egg donation is no longer going to be anonymous, along with the fact that relatives are also allowed. Now see how much minutiae. They are saying that how to retrieve the oocytes also is going to be specified. Maximum 3 embryos can be transferred. Now, this is just some general points that all information should be given to the commissioning couple, and the record has to be maintained for a period of 10 years, and do not mix the semen. This is something which is already being practiced now. They have just repeated that do not mix the semen, do not split an embryo, posthumous gamete collection with prior consent. So this is very good that posthumous gamete collection has been emphasized, but the patient has to give consent before, not after the death. Just the other party cannot give the consent. And pre-implantation genetic testing. Now, there was some information that PGT will become mandatory for all cases of IVF. What is mentioned here is not like that. So PGT, they have given specific indication with the approval when the embryo suffer from pre-existing heritable life-threatening disease. This is absolutely ambiguous statement. How do we know that the embryo is suffering from a condition? We are doing the test to find out if the embryo is suffering. So there is some ambiguity over here. So basically, they have clarified below that PGT is genetic diagnosis when one or both parents has known genetic abnormality to determine if it also carries a genetic abnormality or to identify any genetic defect before pregnancy, which makes much more sense. Now, in ART bank status, there is next statement is a bit unclear, because what they say is that the screening of gamete donor collection, screening and storage of semen should be done by the ART bank, but they are saying provision of oocyte donor, provision of eggs or oocyte donor, because in the other part they are saying that eggs will be provided. So there is some ambiguity here in the bill. And what the bank should do is, see here, obtain the oocyte from the female between 23 to 35 years of age, and for semen 21 to 55 years of age. So whether the bank is going to provide the oocyte donor or the direct oocyte, that exactly has not been specified. But when I spoke to the ART bank, the biggest problem they have is, first of all, the financial issue. Second is, donor will not donate oocytes more than once in her lifetime. Sperm donor will not donate more than once in her lifetime. And all the unused oocytes, they are expecting that out of 7 oocytes collected, you are still going to have unused oocytes, which are going to be preserved by the bank for use in the same recipient. So a completely different level of thought process is going on here as compared to what we are facing practically. I think medical geneticists, gynecologists should not abandon, disown, cause to be abandoned. Now, this is another very problematic point, because in surrogacy, there have been cases where the patient has abandoned the baby. So here it says that the clinic should not cause to be abandoned. The patient will say, my child is abnormal, my child is very preterm, I will abandon my baby. So what is the meaning of cause to be abandoned? How can we make a patient abandon their baby? This entire statement seems to have a very strange background over here. Of course, the other ones are selling human embryos or gametes. Import is banned already, and nobody's going for sale or anything. Exploit the commissioning couple in any form. This is again very vague. Nobody does treatment for exploitation. We are doing medical treatment. So what is the meaning of exploitation? Again, is not specified here. What about the penalties? Court cannot take cognizance except on a complaint made by the National Board or State Board, and no court inferior to Metropolitan Magistrate Court. So the patient has to approach the board, the appropriate authority, and then the state board, then it will go to the national board, and they will go to the court. So there is no direct. And see this, it is presumed that the executive head, so when you are filling the form, the person whose name you are writing as the executive head, everything will fall on their head. It is presumed that they are guilty for any mistake whatsoever. And again, this is just what was written about how the registry and the services are going to function. But here, what I wanted to emphasize was this: whoever contravenes the provision of subsection should be punishable with imprisonment term, which should not be less than 5 years, but extended to 10 years, or with fine, which shall not be less than 10 lakh, but extend to 25 lakh. So the minimum you are looking at is 10 lakh rupees fine for even the smallest of mistake or error, up to 25 lakhs. And penalty is 5 years, which will be extended to 10 years. And whoever contravenes, again, the same thing for contravention, but here it is A to G subsection. So these are all the other provisions. Fine not less than 5 lakh, but extend to 10 lakh for the first contravention, and imprisonment term, which should not be less than 3 years. Means these penalties are absolutely harsh and totally unheard of in any of our professional fields, except for ART. Now, coming to the Surrogacy Regulation Act, this surrogacy bill has been bouncing about since very, very long time. So 2016 was the first time, then referred in 2017 to Rajya Sabha, where I was also there in the Rajya Sabha select committee. I had gone, and then 2019 bill was referred. 8 December 2021 it was passed by Rajya Sabha. 25th December it is notified in the Gazette. So the biggest question that comes to people's mind, the maximum number of phone calls I get is to find out what are you doing now, because some people have absolutely stopped doing surrogacy cases. What we are doing now is that the patients who we have already enrolled, we are doing their treatment as per the current norms. For new patients who are going to enroll, we are discouraging, and we are not really enrolling many new patients, because we are telling them that the bill will be implemented anytime. So very few new patients, but all the current patients that I have registered, we are trying to complete their treatment. And as of now, when the Surrogacy Act implementation date is not there, this notice of 9th October 2014, where it says in the second point below that all the ART surrogacy centers are under PCPNDT Act, this is our current legal status. and the surrogacy contract as recognized by the Supreme Court in Baby Manji Yamada versus Union of India case is the guiding force. Now, this Surrogacy Regulation Act has its own definition, where it defines surrogacy means a practice where the woman bears and gives birth to the child for an infertile couple with the intention of handing over the child. The problem here is that they should have specified that it is by IVF and not by IUI. Means the word IVF should have been specified here. Surrogacy clinic means a clinic, center or laboratory that does the ART services or any establishment conducting the surrogacy process in any form. It's a very, very wide definition. Surrogacy procedure means, see, it includes even the delivery of the birth of the baby. So if a hospital is not doing surrogacy, but they are doing births of surrogacy baby, probably the intention of this is to get them also to register under the surrogacy law. And who is allowed to do surrogacy in India? A married Indian man and woman, where the man's age should be more than 21, woman's age should be more than 18 years, with a medical indication necessitating gestational surrogacy. They should be of the age of 23 to 50 for the woman and 26 to 55 for the man. Do not have a child. So here we have one child norm. If they already have a child, even if it's adopted child, they cannot do surrogacy. They should be childless except if their child is suffering from life-threatening disorder, fatal illness with no cure. And for single women, it is not unmarried women. It is only widow or divorced women. And the age group, see, 35 to 45, I don't know if they are putting such a strict age group when the woman's ovarian reserve becomes so poor after the age of 35, then how is the success rate going to be, or are they encouraging donor embryos? Something which is not very clear from this. And what is different here is now PIO and OCI have been allowed to do surrogacy under this bill because it says Indian origin and not couples with Indian passport. Because PIO and OCI, overseas citizen, they don't have Indian passport, they have foreign passports. Now, who is not eligible for surrogacy? Single, widow, divorced men. Men are absolutely by themselves not eligible at all. Single, unmarried women not eligible. Live-in relationship, LGBTQ, foreign couples who are not OCI, PIO, and a couple who already has a child biologically through adoption or surrogacy. And who can be surrogate mother? Somebody who is married, has to be between the age of 25 to 35 on the day that you do the embryo transfer with at least one child of her own, any willing woman. So not necessarily relatives, but not provide her own gamete only once in her lifetime, but she can have multiple embryo transfers because that is going to be as prescribed with medical and psychological fitness from RMP, must possess eligibility certificate from appropriate authority. So she has to get medical fitness, psychological fitness, and something new called eligibility certificate. The couple has to get a certificate called Certificate of Essentiality from the appropriate authority, Certificate of Medical Indication from the State Medical Board. Order, they have to go to the court before they start surrogacy. They have to get a birth certificate, which is going to be different, called as birth affidavit for the child, and they have to get insurance coverage for 36 months for the surrogate mother. So all the consent has to be in the local language, listing all known complications, side effects. And according to the bill, altruistic surrogacy means there is no charges, expenses, fees, remuneration, monetary incentive of any kind. Only two payments are allowed, medical expenses and prescribed expenses. What is prescribed has not been clarified. Commercial surrogacy they define as commercialization of surrogacy or its component where there is payment, reward, benefit, fees, remuneration or monetary incentive to surrogate mother, dependent or representatives. So gestational surrogacy, they mean now here they have specified that the embryo is not genetically related to the surrogate mother. So this is what should have been specified right at the beginning when it is only altruistic, not for commercial, and of course not for producing children for sale or exploitation. It goes without saying. So bottom line, coming down to it, what is allowed is medical expenses, insurance cover, prescribed expenses. This is a big ambiguous area. What is going to be this prescribed expenses given to the surrogate mother or a dependent or her relatives? And what is prohibited? You cannot give any charges, fees, remuneration, expenses, monetary incentive of any kind to surrogate mother or dependent or representatives. Now, registration of surrogacy clinic, there will be a separate pro forma for registration of surrogacy clinic also, which is valid for period of 3 years. And again, it has to be done within 6 months of implementation of the act. What if the surrogate mother changes her mind? Yes, she has the option to withdraw before implantation. What about termination of pregnancy? You need the written consent of the surrogate mother. You need to go to the appropriate authority first. They will say, yes, you can terminate. So even for missed abortion or incomplete abortion, now surrogacy will become really problematic, because for every termination of pregnancy, if it doesn't come under that, we have to go to the appropriate authority. Embryo oocyte sperm freezing. It seems that all this is going to be prohibited when the gametes are for surrogacy, because no surrogacy clinic, registered medical practitioner, gynecologist, pediatrician, embryo person shall store a gamete for purpose of surrogacy. Now, why this is problematic? If your surrogate mother last minute has some problem, bleeding, you cannot store the gamete. What is going to happen? This is something which actually happens. Last minute problems do come, so we are not very sure now. Import of embryos, gamete completely prohibited. Advertisements, as Brigadier Sharma sir was saying, no advertisements of any kind at all. To induce a woman to act as surrogate, promoting surrogacy clinic, or so completely like you have to work in anonymity. How many embryos can be transferred? Number of oocyte or embryos shall be prescribed. So they are going to tell us how many can be transferred. Of course, the rights of the child remain the same. Biological child strictly prohibit abandonment of the child for birth defect or any other condition. Now, this is excellent here, what says about abandonment of the child. Compare this to what it says in the ART bill. None of this has been mentioned. Surrogacy registry, a registry has to be established where each and every case, each and every embryo transfer done is going to be put in the surrogacy registry. So the authorities involved are National ART Surrogacy Board, State ART Surrogacy Board. There will be maybe even a district medical board, the appropriate authority, and you have to go to the court of a magistrate to get a pre-surrogacy birth certificate for the baby which is going to be born. The registration cancellation. Now again, for this, there is maybe they can take it suo moto on their own, or when they get a complaint, they can give a notice. They have to give a reasonable opportunity to be heard. And if they feel there has been breach of provision, they have the power to just suspend the license and cancel the license. And again, no court can take cognizance of this offense unless the state board, the central government, state government, appropriate authority has represented to the court, and no court inferior to metropolitan magistrate or judicial magistrate of first task and trial. Intending couple or woman who seeks the aid of surrogacy clinic or even just a laboratory where the tests are done, blood tests, or registered medical practitioner, gynecologist, pediatrician, embryologist, any other person not following this altruistic surrogacy or conducting surrogacy procedure should be punishable. There are people here in Delhi who have said that we will not take the blood of any surrogate mother or any patient who is doing surrogacy because they themselves will then have to be registered under the Surrogacy Act, whereas they are just doing an ultrasound or they are just processing a blood sample. The Surrogacy Regulation Act offences and penalties, whoever contravenes any provision of the Act, punishable with imprisonment for a term up to 3 years or fine up to 5 lakh rupees. So the penalties here again are very, very harsh, and the court shall presume unless contrary is proved that the woman or surrogate mother was compelled by her husband. So the surrogate mother is absolutely presumed innocent. This is just data which we had collected and submitted to the Rajya Sabha for giving details of why patients in India are doing surrogacy, and the number one reason was endometriosis, absence of uterus, adenomyosis, multiple failed IVF cycles, and we had come out with some of the guidelines stating prescribed expenses have to be minimum between 2 to 2.5 lakhs, and this is the surrogacy and the ART the bill differences. 2005, the surrogate mother's age was 21 to 45. Now it has become up to 35. In 2005, it was not more than 5 times. Now it is only 1. Foreign couple was allowed, then it was not allowed. Now, then in 2016, only Indian citizen, and now finally the verdict has come that PIOs are again allowed. So when you summarize, the close relative is replaced by willing woman, intended couple of Indian origin instead of Indian citizen. So that means PIO and OCI are allowed. Single woman is also allowed, but the age group is problematic. Embryo not related to genetic mother. So with this age group, is it donor sperm, donor egg? This is no clarity. Insurance cover is mandated 36 months, harsh punishments, and intended couples should not have their own biological or adopted child. And there is little bit discrimination here for surrogacy birth children because they will not have a normal birth certificate which they are having now. They will have birth affidavits. Commercial is planned, and of course the time period here has not been specified. So presently surrogacy is legitimate because no Indian law prohibits. And indeed, this is what we say, I'm doing my best because I'm counting on you, counting on me. And to end some nice positive news where the surrogate woman entitled to maternity leave benefits and to distinguish between them and surrogate and natural mother is an insult. 5 high courts now have given maternity leave for surrogacy. One of the patients whose leave was rejected the judgment has been overturned. Central government has said, please give wide circulation to this notice where they can get paid maternity leave of 26 weeks. And Amazon, Google, so many, Microsoft India are now giving surrogacy leave. एक बेटा सौभाग्य से होती है, एक बेटा भाग्य से होता है, पर बेटी सौभाग्य से होती है. So thank you everybody. I think there was just 1 or 2 slides somehow. I don't know, they have not come in this. That was about the provision of collecting no more than 7 oocytes from the egg donor, which is something which is very well known. Dr. Jyoti, I leave the floor open to you so we can just go through this now.
Yeah, thank you so much. Thank you. That was absolutely wonderful, wonderful coverage of the whole bill, whole ART and the the SRA bill. So this is like, oh, Sara. This bill is like eating our peace of mind. What do you say, sir, Brigadier Sharma, sir? But I think we have to all bear with it. We have to follow it, and we have to, because we live in the land of law, we should be following it. So thank you so much, Dr. Shivani. Dr. Seema, should we start with the panel, or what do you say?
Yeah, we can do panel, or we can ask for somebody has some questions. I think we can cover it in panel only.
Okay, I think, yeah. So we have the panelists here. First of all, I would like to thank Dr. Sharda Jain ma'am